Hello, I'm Dr. Joe Iser, Chief Health Officer for the Southern Nevada Health District. We in public health, along with healthcare providers and tobacco control advocates, have worked very hard and have reduced smoking rates tremendously in the United States. Yet in spite of all of our collaborative efforts, 40 million Americans still smoke, including 388,000 Nevadans. In fact, more than 1,000 Nevada youth under the age of 18 become daily smokers. Tobacco-related healthcare costs in the United States are about $170 billion, and in Nevada, that cost is about $1.08 billion. Tobacco use continues to be the leading cause of preventable death in the country. Each year, 480,000 Americans die from tobacco-related causes. While the good news is that traditional tobacco use is declining, another challenge has crept up in the continued fight against tobacco and the diseases that it causes. That challenge is e-cigarettes and vaping products. Here's what we are facing. In recent years, sales of e-cigarettes have grown dramatically. The Centers for Disease Control and Prevention and the Food and Drug Administration recently reported that young people are now using e-cigarettes at a higher rate than they are using conventional cigarettes. For example, in 2011, just 5 years ago, 1.5% of high school students reported that they used them. In 2015, that number increased to 16%. Among middle school age youth, 0.6% of those students used e-cigarettes in 2011, and in 2015 that number increased to 5.3%. Among Clark County high school students, e-cigarette use has climbed to 24.8%, while conventional cigarette use has dropped to an all-time low of 5.9% of these students. A national CDC survey showed that the number of young people who have used e-cigarettes but have never smoked conventional cigarettes has tripled in just 3 years, going from 79,000 in 2011 to more than 263,000 in 2013. This is a troubling trend for many reasons. Research also shows that young people who have used e-cigarettes are twice as likely to use conventional cigarettes. In addition, studies have found that e-cigarette smoking and the link between smoking initiation was stronger for those who had lower risk factors for smoking. This means that for young people with a lower risk of using conventional cigarettes, e-cigarettes are a stepping stone to conventional cigarettes. The alarming trend of e-cigarette use by young people raises many serious concerns. While the e-cigarette and vaping industries claim their products are not unhealthy, there are many unanswered questions about what impact these products have on the health and safety of the people who use them. Adolescents are especially vulnerable to the addictive effects of nicotine, and current trends raise concerns that these products are a gateway to the use of conventional cigarettes among younger people. Adults are not immune to these products either. Use of e-cigarettes is increasing among adults as well, especially among 18 to 24-year-olds. According to the 2014 National Health Information Survey, 21.6% of people in this age group have tried an e-cigarette, and 5.1% were currently using them every day or on some days. There are two issues of particular concern. The first is that many adults and young people report that they use both e-cigarettes and conventional cigarettes. About 59% of adults and 76.3% of youth report dual use. This idea is not surprising since the marketing efforts of the e-cigarette industry encourage the use of its products where conventional cigarettes are not allowed. About 80% of e-cigarette users cite this loophole for using e-cigarettes in smoke-free zones. The Southern Nevada Health District and the Nevada State Medical Association both advocate including e-cigarettes and vaping products in the Nevada Clean Indoor Air Act to address this very issue. The second issue of concern is the belief by some e-cigarette users that these products are effective smoking cessation products. A study of current and former smokers found that while e-cigarette smokers did reduce the number of conventional cigarettes that they smoked per day, they were no more likely to quit than smokers who didn't use e-cigarettes. It is important to note that the CDC emphasizes the importance of quitting smoking completely, not just cutting down. Even a few cigarettes a day are dangerous to your health. E-cigarettes themselves are harmful to health. The CDC also reports that secondhand aerosol released from e-cigarettes can contain heavy metals, ultrafine particulates that can be inhaled deep into the lungs, as well as cancer-causing agents. Inhaling e-cigarette aerosol directly from a device or from secondhand aerosol from an e-cigarette user is potentially harmful. Secondhand aerosol should be treated like secondhand smoke from conventional cigarettes. Non-tobacco users should not use or be exposed to secondhand aerosol from these products. An additional issue of concern is the number of poisonings that are the result of exposure to the liquid nicotine in e-cigarettes. The number of calls to poison centers that involved liquid nicotine was 1 per month in September of 2010. By 2015, that number jumped to 215 per month. In Nevada, between 2013 and 2015, of the 97 calls received by the Poison Center that were related to nicotine-based e-cigarettes, 65% of them were related to children under the age of 5. In a recent win for public health, the FDA issued a final rule that extends its authority to regulate all tobacco products that were excluded from the Federal Food, Drug, and Cosmetic Act. This now includes e-cigarettes and vape pens, all cigars, hookah, tobacco, pipe tobacco, and nicotine gel, as well as other tobacco products. While there are some notable omissions to the law, including allowing the tobacco and vaping industries to continue to produce and market flavors such as cotton candy, chocolate, and strawberry, this was a huge step in the right direction and a major milestone for public health. For more information on e-cigarettes and vaping products, visit our website, gethealthyclarkcounty.org. For free help quitting the use of e-cigarettes or any tobacco product, call 1-800-QUIT-NOW.